Hi, this is Dominic Merz, the first author of a systematic review and meta-analysis with the title Populations at Risk for Severe or Complicated Influenza Illness. About 3 to 5 million cases of severe influenza and up to 500,000 deaths attributable to influenza are reported annually worldwide. Priority of vaccination and treatment should be given to high-risk groups, and most countries have their specific recommendations. However, a comprehensive and systematic review of the evidence defining these risk groups is currently lacking, but definitely necessary to optimally allocate vaccines, in particular in the setting of a vaccine shortage. The here summarized systematic review, which was initiated and funded by the WHO, aimed to critically review the evidence supporting these risk factors for severe outcomes. We included observational studies reporting on at least one risk factor outcome combination of interest, searching a number of databases, including patients with laboratory confirmed influenza or ILI during influenza season with no limitations in terms of risk factors, with outcomes of interest including pneumonia, hospital and ICU admission, ventilator support, mortality, and any composites of these outcomes. This is our search strategy, which was very broad, so we ended up with almost 50,000 records to be screened after duplicates removed. And we included 234 articles reporting on 239 datasets or studies, all published between 1918 and 2011. The vast majority of studies on pandemic influenza were conducted during the 2009 H1N1 pandemic. For seasonal influenza, most studies were conducted in the last 10 to 20 years. We included a total of more than 610,000 patients. 97% of studies were cohort studies and 92% of studies used laboratory confirmation of influenza. We conducted a large number of meta-analyses, which are all reported in detail in our publication, and I would like to focus on 3 key findings here. First of all, we found that obesity was one of the most important risk factors for severe outcomes. Here the data for mortality with seasonal and pandemic influenza combined with an odds ratio of 2.94. On the other hand, we didn't find any evidence that Native Americans or other ethnic minority were at higher risk for severe outcomes other than higher likelihood of hospital admission. Here showing you mortality data for Native Americans during the H1N1 pandemic. And the same was true for pregnancy and mortality and other outcomes other than hospital admission. No higher risk for pregnant women. However, we identified the first 4 weeks postpartum as a period of time with a higher risk of death if infected with influenza. We summarized our findings and the level of evidence in this table in our publication. As you can see, using the grade approach, the vast majority of risk factors identified were at a very low level of evidence, while a total of 4 risk factors were deemed to be at a low level of evidence, including the presence of any risk factor or comorbidity, obesity, any cardiovascular disease, and any neuromuscular disease. Limitations include the lack of data for non-2009 H1N1 pandemics and for studies during seasonal influenza, in particular for non-H3N2 seasons. There was a lack of power to draw definite conclusions for many risk factors and lack of adjustment for confounders. In fact, adjusted risk estimates were reported only in about 5% of risk factor outcome combinations, and on average there was moderate risk of bias in included studies. In conclusions, policymakers and public health organizations should acknowledge the poor quality of evidence supporting vaccine recommendations for certain risk groups. We identified obesity and the postpartum period as potentially new important risk factors that should be considered. Pregnancy and ethnic minorities, in contrast, were not found to be at increased risk for severe outcomes other than hospital admission. And last but not least, we would like to emphasize that well-conducted and powered studies are needed. Thank you very much for your interest.